Hi, I'm Estrella Thomas. I'm a Body Image 3D ambassador, and I'm here with Body Image 3D. And I'm talking to Dr. Stephanie Setliff. Would you like to introduce yourself?
Yes, I would. Thank you. I'm Stephanie Setliff. I'm a child and adolescent psychiatrist here at Children's Medical Center on the Plano campus of Children's, and I'm the medical director of the Eating Disorders Program, and I treat young children as young as 5 and children as old as 18, boys and girls, for anorexia nervosa, bulimia nervosa, and other like disordered eating. So what do you want to talk about?
Okay, so we have a few questions regarding your specialty with eating disorders. But what do you think some of the factors are that perpetuate eating disorders?
Well, I mean, I think that it's complicated, you know. I think that it has a lot to do with family history. You know, people that have depression and anxiety in their family or eating disorders in their family are more likely to have an eating disorder. I think that, and then we know that there are like temperamental traits that you're born with that can make you more vulnerable to an eating disorder. Traumatic events, big traumatic events, little traumatic events. You know, and then things that are kind of obvious, like the media, and the way that girls feel about themselves in general, that girls are held to a thin ideal that really doesn't exist, but they're made to think that it does, and that they're not worthy unless they reach it. So, I mean, it's complicated.
Yeah. Could you talk more about the media component and how that influences women?
Yeah, I mean, so the media is really powerful in the way that girls and women and boys and men think about themselves, and it sends lots and lots of negative messages to people, blatant messages, and also messages that they don't even really realize that they get. I mean, most people say that are in my field that girls and children in general get about 400, they're bombarded about 400 messages a day about themselves, their body, their weight, their looks, etc. And they don't really know what to do with it. They don't even necessarily know that they're getting them. So I mean, I think there's that. And then the other thing that I feel like I always have to tell people is that children now, and even kids your age, I mean, you guys have really never seen print media that is not photoshopped.
No.
You didn't have, by the time you guys started looking at magazines, photoshopping was already happening, and so really you don't see real images on magazine covers and in magazines anymore.